All right, it's 2 o'clock. I want to welcome everyone to the Center for Excellence in Disabilities Ability Grand Rounds for this month of November, this chilly month. Um, Today, we're honored to have Brittany Smith present us some of her work within the ACES area, and Brittany has also worked with us on a module for the impact grant that we have focused on substance use families. So I'm excited to see, to listen to her presentation. Brittany is a student in our very own School of Public Health here at WVU. She has many accolades, is recommended strongly by everyone in public health, and just a joy to work with. So with that, Brittany, I'm going to turn it over to you. Just in terms of housekeeping for everyone, please remember to mute your lines. If you are using both a computer and a phone, mute one of those. It's fine. And that'll just keep down some background noise. Um, this is recorded. We do have closed captioning for those who want to use that option. Should be down below. And then lastly, we have a chat function in here. Everyone should have an option with a little comment button or bubble at the bottom of their screen. If you want to submit a question to Brittany, and Brittany will help facilitate this because your mind will be focused on the slides and sharing your information with us. But if you have a question for Brittany, that can go into the chat. Otherwise, we'll save the last few minutes or so of the hour for questions and answers. How does that sound, Brittany?
Okay. That sounds good.
Okay, I appreciate it. So remember to mute your lines, and Brittany, I'll turn it over to you.
Well, thanks everyone. I'm so glad to see you all joining in, and thanks Dr. Koppel for the introduction. So basically, what we're going to do today is we are going to go over a little bit of the foundation of adverse childhood experiences, just a brief overview, kind of speaking about what they are, what happens to the body whenever one's experiencing these types of things, and then we're going to start getting into two research projects I've conducted with some of the faculty in School of Public Health. One is a qualitative study, and we were interviewing women, asking about their experiences, and some interesting themes came out there. And then the other is a case control, but we'll get more into that once we've got a little deeper in the presentation. Okay, so first, what are adverse childhood experiences? Any type of traumatic experience that occurs before the age of 18 is considered an adverse childhood experience. And something I always like to note here is really it's up to the individual what they consider traumatic. However, there are events that we know for a fact are basically across the board traumatic for just about anyone. And when you're thinking about these experiences, it's not only when a child is being victimized, it doesn't have to be them directly being impacted by physical abuse or emotional abuse. It can also be them witnessing this happening in the home. That has much more of an impact than many people understand. And also, research often links adverse childhood experiences, not only mental health outcomes, negative mental health outcomes, but also negative physical health outcomes. So the landmark study that was done by Vincent Felitti in 1998, it had over 17,000 participants. And whenever he did this study, he was looking more into the obesity clinic. Basically, I'll give a little bit of backstory on that. He was running an obesity clinic. He was finding that his program is working. Women were losing weight, but then suddenly after so long, they would gain all the weight back. So he, honestly, when I was speaking to him, he messed up his wording one day. And instead of asking women, how old were you when you became sexually active, he asked them how much they weigh when they became sexually active. And one of his participants told him 3 pounds. And that's when he started uncovering that sexual abuse might be linked to some of the weight gain that he was seeing. And in this study, he went ahead and looked at multiple different negative health outcomes and was able to see that ACEs were actually linked to many of these leading causes of death and disease. A recent study, some of you might have got the CDC report that came out, but they've kind of done the study again, and it shows the similar results. So 5 of the top leading causes of death right now are linked with ACEs as well. Some of the diseases you can see that are linked with ACEs are heart diseases, cancers. Autoimmune disease is one that is often overlooked, but this is particularly affects women. And then respiratory disease, stroke, Alzheimer's, diabetes, you can see the list. And one of the things that gets confused often is some people believe, okay, well, it's because they experience these things and they take part in certain behaviors. While that is true, they are more likely to take, people who have experienced ACEs are more likely to take part in negative behaviors. A lot of these diseases have to do with the inflammation response that occurs within the body when they've experienced ACEs and they have a toxic stress response. So when the stress response is activated repeatedly. So let's talk about the types of adverse childhood experiences. In the original study, in the 10 concrete that are often used, we call them the original or traditional ACEs, they would be abuse, neglect, and household dysfunction. So that includes any type of physical abuse, sexual abuse, and emotional abuse. And as well as the household dysfunction does include divorce, mental illness, witnessing domestic violence, and something here in West Virginia that we're seeing a lot of is parental substance abuse. And with parental substance abuse, if that's occurring in the household, it's much more likely for many of the other types of ACEs to be occurring in the household, especially neglect. So those are the 10 that you see that often are used in research studies and things of that nature. However, even though those were the 10 ACEs that was used in the original ACE study, there are studies that show that there are other types of adverse childhood experiences, which of course you probably can think of many of them. So violence in your communities, gang activity, a child being bullied at school if they're homeless, or even losing a parent. And one that we all are very interested in here in West Virginia is foster care placement. So this is, of course, a very traumatic experience as well for children that will actually activate their stress response more often than it needs to be. And this image here just goes to show you a lot of the different types of ACEs that we're seeing. So if you look at the tree, those are household ACEs. So those are the things that are actually occurring within the family where, it's just a family system, and that's kind of what's happening there. But if you go to the roots, and sometimes you can see these are community ACE factors. So living in a place with not sound jobs, bad structural housing, poverty, violence, different things like that can also lead to those household ACEs being more common. So as you can see, those also play a role and are adverse for children. And then the one they've added that's real interesting is the environment. So different types of environmental crises actually will trigger a stress response in children, which that makes sense. If you have a tornado or floods, that's very traumatic. As a child, I remember it flooded where I lived, and that was something like I'll never forget. It was traumatizing for me, even though it was nothing that anyone can control. So what we need to know is, how do adverse childhood experiences, how does something that happens to us makes us sick? So what we've seen is that when we look at brain scans, is when a child has experienced 4 or more adverse childhood experiences, their brain actually changes. When you compare them to children who have not experienced such experiences, their brains are actually smaller in size. There's actually a physical decrease in size. So the various physical, mental, and behavioral health outcomes that are a consequence of ACEs, this happens because of an abnormal stress response. So the abnormal stress response, we're going to break that down a little bit. So what happens is we will see that a child, if there's any type of threat in the environment, the child will be stressed. Cortisol hormone levels will go up. And then after this, normally there's a caring adult or there's some way they are soothed, and then that comes down. However, with ACEs, whenever this happens, there's never a coming back to baseline. So you do not see children coming back to baseline. Sorry. Okay. So when children aren't coming back to the baseline, you can really just think of it as they're being marinated in stress hormones. And when these stress hormones are so prevalent in the body, you're going to start seeing a suppression in the immune system. You're going to see an increase in inflammation chemicals, so chemicals that are going to cause inflammation throughout the body. And you also see issues with digestive function as well as heart function. You'll see issues with the endocrine system as well. So the endocrine system will often have issues secreting the right hormones at the right time. So sometimes children will hit puberty earlier, sometimes it will affect their growth as well, because their stress response is constantly turned on and they are marinating, like I said, in cortisol and stress hormones, which are not meant for us to marinate in. These are hormones that are made so that we can get out of a stressful situation. They're there to aid us and then be shut off. However, these kids are constantly living in this state. And something also that's a negative consequence of this response is that once this starts happening often, the child's stress response is more sensitive. So meaning that things, even when there's not a threat, something will seem like a threat, and that stress response will be turned on, just feeding that cycle of flooding the body with cortisol. So the toxic stress response, I've used that word a few times, but that's just the phrase we use whenever we're talking about the stress response being activated for prolonged or repetitive periods of time. When the supportive adult is around, that's when stress gets way out of whack. So one thing is horrible stress. So say that a child maybe loses a family member, or there's a crisis in the community such as flooding, tornadoes, anything like that. Normally the presence of an adult will teach them how to soothe themselves. Therefore the stress isn't toxic. However, when the person who is supposed to be caring for you is inflicting pain and harm towards you, they obviously are not going to be able to soothe you. Therefore, their stress response is activated much longer, like I was mentioning in the previous slides. So the big problem here is the absence of a supportive adult figure, and the fact that the person who is supposed to be their caretaker, their primary attachment figure, is in fact causing the pain. That goes against the entire biology of children. So again, here we'll see a picture. Not all stress is bad for kids. Sometimes we have parents who may hover and come over their children when they don't experience any type of slight stresses that can actually help them deal with challenges in the future. And that's what we consider positive stress. So meeting new people, if you get a new babysitter, or going to a new school, those are all things that we consider positive stress. The parents should kind of, stand back and let the child go into this. However, you also see tolerable stress, which are things that are, can be pretty traumatic for children, like a death in the family. But you have the parents there, so the child is able to return to baseline. You do not have a flooding of chemicals. However, we see toxic stress is where the child is overwhelmed. They have no support, and they're not getting their needs met. Therefore, it becomes overwhelming for them and starts leading to So, the body systems that are most affected by cortisol are three are main body systems, actually. You have the nervous system, endocrine system, immune system, and cardiovascular system. So with one thing I want to mention about the nervous system is what happens there is we all heard you basically use it or lose it. When a child's brain is developing and they are put in these stressful environments and dealing with a lot of toxic stress, the pathways in their brain that are meant to help them in fearful situations and activating the stress response becomes strong, big connections. Whereas the other things that are supposed to be developed, self-regulation, things that are helping with decision making, those are not being used, and you're starting to see some pruning already. So those are not strong, which does not set a solid foundation for the children. As we're seeing with the endocrine system gets very affected because when cortisol is in the body, it will affect many other systems. I'm not sure if anyone here has heard of Nadine Burke-Harris, but that's how she's a Surgeon General in California, and that's how she became aware of the physical impact of ACEs. She'd seen a little boy in her clinic. He looked like he was 4 years old. He was very small, and come to find out, he was 7 or 8 years old, and she couldn't understand why he wasn't growing. They gave him the growth hormones, etc., etc. However, that wasn't working. Come to find out, the little boy experienced sexual abuse at the age of 4, and that is when his endocrine system started to dysregulate, stunting his growth hormones from actually working properly. And once they start doing therapy and interventions for the sexual abuse, that's when they started to see his growth progress and get back on track. But the immune system, we went over that as well. That's basically, it's kind of interesting because it gets suppressed. So these children are more likely to be sick, complain of colds, and have colds more often. However, the body is also ready to have an attack. It's ready for any type of attack. And that means there is more inflammatories. And the inflammatories is the big issue with physical disease, because you're causing inflammation in many different areas that do not need inflamed, especially for that long. And that's one reason there's a link with autoimmune diseases. So the body is, certain parts of the body is inflamed, and the immune system starts to see that as foreign. And this is just a kind of just so you can see what's going on in the brain. You'll have a stressor that activates the fear system, which is the, excuse my mispronunciation of this, but the amygdala, oh goodness, sorry, where's going, you can read that. And we start to see a release of cortisol, and the heart starts to race, blood goes to the muscles, your digestive system shuts down, and memory is impacted. And that's a huge thing here, because often we talk about there are children who do not remember their childhood. There are children who do not remember a lot of things that happen to them. And that has a lot to do with this memory being impacted by the release of cortisol. So I'm not sure if anyone here has ever heard of Gabor Mate, but he is a physician in Canada who he does work with addiction and childhood trauma. And through his work, he has found that most of the people he deals with who are addicted actually have strong childhood trauma, or ACEs. And from where they were not receiving the type of nurturing they needed when they were little, systems in their brain are affected. So one is their attachment reward system, their incentive motivation apparatus, as well as self-regulation. And what we were seeing is when there was not parental attachment there and the parents were not attuned, basically these systems never got regulated properly. So when they age, they start needing to supplement, basically not having the natural chemicals they need with outside chemicals such as drugs or even behaviors that would help them release the natural opioids and dopamine in the body. So that is something, if you read In the Realm of Hungry Ghosts, it's a fantastic book. I highly recommend. But it will start showing you how basically not having your parents in the beginning be attuned to you will affect these systems and cause you to have to supplement so that you can have the chemicals you need to function and feel alive. And here's just one of my favorite Mate quotes. It is impossible to understand addiction without asking what relief the addict finds or hopes to find in the drug or addictive behavior. And that is really how childhood trauma and substance abuse begins to get connected, because it is normally an attempt to restore one's own biology, that where they're normally compensating for what they lack, for what most people's bodies are doing by themselves because they were able to get the proper attachment. They end up supplementing with drugs or other addictive behaviors. And once we get into my research, you'll see why this is relevant, like parental ACEs. So for a while, no one really was paying attention to a parent's ACE. We were only seeing the child's ACE. However, more research is starting to go into and cover what happens whenever parents have high ACEs. So when a parent has a high ACE score, this is able to affect the child intentionally and unintentionally. So sometimes this may mean that the parents are often using the same methods for discipline as their parents use, which is part of why they have a high ACE score, so emotional abuse, physical abuse, and they may not know any other way, leading to their children having high ACE scores. These parents are also more easily stressed. As I was saying, whenever you experience ACEs, your stress system becomes more sensitive. And when that happens, you're stressed out more easily. And parenting is already a stressful task in itself. So imagine being even more sensitive to this stress. leading to neglect, frustration, different types of things that are going to negatively impact their child. And something that we have seen, however, is that a mother's ACE score is more predictive of child's negative health outcomes. So when a mother has a high ACE score, we'll see a lot more behavioral health problems, emotional disorders, ADHD, and different things of that nature. And overall, when a parent has a high ACE score, you also can expect to see poor parenting practices. And I don't believe I went into it too much into this, but if you feel like looking into it, you can also look into epigenetics. So basically how the environment changes how your genes work. That happens when your parent has ACEs. They're able to, whenever they create you, they're able to transmit that on in their children. So that's something to be very aware of, is that there's actually some evidence that is showing that you can inherit trauma and how you deal with trauma. So to get a little more into West Virginia and what's occurring here, we obviously have substance use epidemics. I often don't always say the opioid epidemic, because I know in West Virginia we kind of, every so often we switch drugs. One year it's amphetamines, and then it goes to opioids and etc. So if we just kind of think about that, we're always having children who have parents. We have a large population of children who have parents who are addicted to substances. And interventions are not often geared towards them, so they often suffer in silence. As many of you know, West Virginia has the highest overdose death rate, resulting in children losing their parents. That's a huge problem, as well as the neglect and different things that come from parental substance use. Combined with this overdose death rate, we see a increase in the children in foster care, because 85% of those children in state custody actually do have parents struggling with addiction. So this in itself is very traumatizing for a child, and in fact will cause them to have high levels of cortisol in their body, and for them to be dealing with these negative and be prone to these negative health outcomes. And also, children who experience ACEs, it's interesting to look at this relationship, because a child who has disabilities, who already has disabilities, they are more likely to experience ACEs. And then also, when you experience ACEs, you're more likely to develop disabilities. So that's something when I've done my work, I've been looking at, I was like, oh, wow, okay. So it's really affecting child disability whenever we're talking about ACEs, because if you have a disability, you're more likely to be neglected and abused. And also on the other end, if you do not yet have a disability and you're neglected and abused, you're more likely to develop one. So in a study, they've seen that 70% of children with ADHD, they actually had ACE exposure. And children who had autism spectrum disorder, they are 1.6 times more likely to have experienced more than one ACE. And 83% of children often have intellectual disabilities. In a lot of research, you'll see them speaking about academic delays and different problems, trouble reading. And that's because when you're in survival mode, like I was talking about with your brain, these children's brain, their brains are being primed so that they know what to do in fearful, chaotic situations. Their brains are not putting energy towards the different connections in the brain that are for reading and learning math and critical thinking. That's not what is important to their survival at the moment. Therefore, energy is not going to be exerted for those connections, and they aren't really gaining experiences at home in order for those connections to even begin to develop. And with adverse childhood experiences, there are many different types of negative health outcomes that you'll see in children. It's often talked about how these manifest later in life. However, when the child is experiencing trauma, you will see some different things. So that can include hair loss, constipations, aggression, depression, anxiety, self-harm, and those types of things. But one thing I want to draw your attention to would be perfectionism. Often these children are unnoticed because they are performing well. So they'll be your kids who are receiving straight A's in school. They're doing excellent. They kind of stick to themselves. They're not a problem. But you may see that they may have very dramatic outbursts if they are not performing perfectly. They'll need to be in control. And this comes from basically being a caregiver in the household and feeling that they have to prove their worth through their work, because at home they're not being valued just for being a child. They feel as if I'm perfect, no one will notice me, and then I can go ahead and get out of the situation I'm in. Or if I'm perfect, they'll have no reason to punish me, or, oh, maybe this will make them proud of me now. So that is something that I always like to draw attention to, is because it's often not paid attention to until way later in life. And you'll see your people who overfunction, who are trying to basically make their work their worth, and they end up being more likely to have depression as well. And of course, sometimes ACEs are inevitable. As you've seen, there was divorce on that list, and you have your environmental factors. And there are things that we can do for children, which is resilience, which I'm sure you've heard of. So that's making the child able to adapt to these different situations. And the best way to do that is truly to be a supportive, consistent caregiver for that child. So when they have a person there who's able to comfort them, their bodies are able to build resilience. But another thing I want to talk about, it's not mentioned much, is post-traumatic growth. That is something we see in adults more so whenever they've experienced trauma. It has, in fact, derailed their life, caused crises. However, they become a more developed person after the trauma. You may hear people say things such as, I wouldn't be who I was without the trauma I experienced. And that has a lot to do with post-traumatic growth. So basically surviving through those things and continuing to build their life afterwards gives them a sense of growth. And it is a growth because they actually are able to deal with some things that they weren't able to deal with before. So I'm going to start getting into some of my research studies. And the first study we're going to go into was a qualitative study that was done in Morgantown, West Virginia. And what we did is we went to the Coat Clinic and we simply asked women, we were looking for women to tell us about their intimate partner relationships, their issues with substance use. So just seeing how those two things crossed over. So when we were interviewing them, we didn't ask them any questions about their childhood or their children. That wasn't what we were probing for or trying to get to. However, what you'll find very interesting is that regardless, those themes came out in our studies, which for me, I'm a person who does ACEs, and I was like, oh, okay, well, this is a good experience. But the amount of feedback I got from the women on how really their childhood relationships and things happened to their children also affected their issues with substance misuse. So from that study, we're just going to share a little bit more about the themes that arise, and I'm going to look more into the quotes that we got that kind of will explain some of the trauma and things that happen with women who are dealing with substance abuse. So this one, we'll start with our first quote, which was, I was on my own. I have a daughter with disabilities, and I dropped out of college. I was depressed, and I was self-medicating, and it just became a problem from there. So here we can go back to the disability slide where I was speaking about children who have disabilities are more likely to experience ACEs. So here's a perfect example of a woman who she had a daughter and was on her own and had a hard time coping with the different stresses of being a parent, especially with a child with extra needs. She began to use drugs to be able to function as her mother and cope with those things, which obviously negatively affected her daughter and caused her daughter to experience stress and eventually the absence of her own mother. Next quote. Okay, I've been here about 4 years. I started coming because I found out I was pregnant. She's 3 now, so yeah, about 4 years. Yeah. Had I not got pregnant, I probably would still be out there using or in jail by now. So she was my wake-up call. So this theme just showed us how children, in fact, play a role with their parents' substance misuse. Be it that the mother is more stressed out by the child, or if the child coming into the world makes the mother want to actually get clean and then a motivator for them. So maybe they're wanting to prevent their child from experiencing ACEs. However, the big issue here with this is it's difficult to deal with the stress of being a parent as well as the stress of recovering. So those are two things that are very difficult. However, this is a common theme of why women will in fact enter substance use treatment. Next quote. I used when I was pregnant a few times, and then once I had the baby, that changed everything. It's scary when you have a kid to take care of, and all that stuff from the past is still coming out. It takes a long time to get away from it. So here we're seeing one, that you have a mother who she's using substances, and once her kid is here, she's still dealing with the past of her substance use, which that is very triggering. So I know this woman, for example, dealt with her spouse wanting to tell, he would tell CPS, who'd go, I'll tell CPS if you don't do this about your past drug use, and they'll come and take your children, etc., etc. So this is another time whenever children are actually, being placed in very complicated and stressful situations with their parents' substance misuse. So now we are going to go into the study that myself and Dr. Brummage at WVU actually designed. And what this study, I'll give you a little background on the study, is a lot of the times whenever a woman enters substance abuse treatment, at least to my knowledge, it's adult-centric. Sometimes the children are left with a family member, the child goes into foster care, many different things of that nature. Therefore, the children do not receive any types of intervention, even though research shows us that they're more likely to experience adverse childhood experiences that will in fact possibly lead to their own substance use, or in fact lead to other negative health outcomes. And also this at times prevents mothers from entering substance abuse treatment as well, because they don't want to be separated from their children. So just a little background, whenever we were doing our research and we were about to look at what our goal was to look at the ACEs women had experienced if they were in recovery for substance misuse, but also have them report to us their children's experience. And we compared that to a control group, which was Cabin Creek Health Clinic in Charleston, West Virginia. And our sample, so our women in recovery, came from Recovery Point in Charleston, West Virginia. And our main goal was really just to look at the ACEs in this parent-child relationship. So looking at both ACEs, seeing how they were related, seeing if there was high prevalence in, mothers and children, because if that's the case, there possibly needs to be some changes to how we're doing treatment. So just a little background from the literature review is that women, more so than men, they're more likely to misuse substances in order to cope with their childhood trauma. Also, we found that 70% of women who enter treatment for substance use disorder, they in fact do have children. And the children of parents with substance use disorder, they're more likely to experience ACEs and experience their own problems with substance misuse. So if you kind of think about these things, you can see how substance misuse, ACEs, and the mother's experiences all can combine together in order to really cause a disaster for the family. So we had three goals of this study. One, it was determine ACE prevalence in women in recovery from substance misuse and their children. So again, finding out those ACE scores from 0 to 10, we use the traditional ACEs. We only ask about those 10. There were other trauma questions, which we'll bring up a little bit later, but those aren't considered ACEs. They were kind of just to capture some of the things women had experienced. They had used substances. We also wanted to see, just to show in our sample, if there was a relationship between adverse childhood experiences and substance misuse. In other research studies, this has been found, but again, we wanted to look at it ourselves. And then we also wanted to look at the relationship between maternal ACE score and a child's ACE score. So how did mom's ACE score at all play any role in the ACE score of her children? So with our methods. So it was a case control study, and a case can be defined as a woman who was over the age of 18 and she had to be receiving long-term abstinence-based substance misuse treatment. So they had to be from Recovery Point, where they do not use medically assisted treatment. Our control group was females who were over the age of 18, and they were not receiving treatment for substance misuse, and they also did not have a history of receiving any type of treatment for substance misuse. When we went there, we wanted women who had children. They were preferred. However, we did not exclude women from the study if they did not have children. And the measures we used was, again, the original ACE questionnaire, so on neglect, abuse, and household dysfunction. And you'll see the ACE-Q. A lot of people have questions about how we got the ACE scores for the children. And the way we did that was we didn't ask the women to report the particular ACE their child had, but to give us the score. So there was a list of all 10 of the ACEs, and then a mother would go in and just say, okay, 4 of these apply to my child. We didn't know which 4. And again, the ACE scores could range anywhere from 0 to 10. We're just going to look at our demographics. You can see our cases were average 33 years old, and where our controls were 38. We had majority whites of white race in our sample. And something interesting here you'll notice is that the cases had more of them had children than our control group. And we also had 72% of women who were our cases who were IV drug users. And then we get down to the ACE scores. So you'll see at the bottom there where it says mean ACE score for cases was 4.9. When it comes to clinical relevance, an ACE score of 4 or more is like where you have the red flags. That's like they are at high risk. Like, we need to do something here. More likely, they're going to develop severe negative health outcomes. However, the ACE score for the controls was 1.9. And then for their children, you see that their children, when we took the average of their ACE scores, it was 3.9, which again, very high. This is, concerning. It's a red flag. But the controls children, they only had a mean ACE score of 1.3. And when we did the t-test to compare these, there was a statistically significant, the difference was, with a p-value of less than 0.001. An ACE category. So this is where we just went with the women only. So this is only the female participants. And we were looking at basically what type of abuse did our cases, so our women in recovery experience versus our control group. And here you can just see already really sad. You can have with abuse, emotional, physical, sexual abuse, they were much more likely to experience these types of abuse than their controls. And that goes all the way down the board. We did t-tests, so we compared these averages, and there was statistically significant differences each time. So the women who were cases actually did experience every form of ACE much more than their controls did. Just give me a second to see that. So I'd mentioned that we talked about some other forms of trauma. So these were not traumatic experiences that we were just very interested in looking at different types of experiences. So one that I found very startling was that 46% of the women in recovery had experienced the death of their spouse, romantic partner, or child. This, again, was much larger than the percentage of women in our control group who had experienced this. Something that goes into the sex trafficking crisis we're also experiencing in the United States is that 1 in 5 of these women had actually been used for pornography or sex trafficking. So just again to show, you already have stressful childhood experiences or things happening to you in your childhood, and then these things continue to happen. So you begin to be even more stressed and get even more dysregulated as time goes on. So next, you'll see that before the age of 18, this is one of the most obvious ACEs, but it's not listed. And it's that before the age of 18, 46% of women in recovery had been separated from their parents. And that is a huge thing that will absolutely destroy a child's life, truly, is not having their parent there for them. Because some people will say, oh, well, maybe they were experiencing abuse at home. And yes, it was best for them to be separated from the parent. However, that still is traumatic because we know that no matter what, kids still deep down love their parents. So even if it was best for them, it still causes a lot of stress. So I want us to pay close attention to this chart. So this chart here is looking at women only. This does not include children. So we are comparing the ACE scores. The green is our controls, so our women who were not using substances, and the gray is our cases. So when we look at that 4 or more, that again, like I said, is our red flag area. That's where we start seeing a lot of negative health outcomes. And you can see here that 33 of the 50 women had an ACE score of 4 or more, compared to 11 out of 50 of the women who were controls. And that's huge, because 33 of these women, kind of from an early age, before 18, had experienced a lot of trauma that made them more susceptible to actually abusing substances. This chart gets extremely upsetting and is eye-opening, I do believe, because here we're looking at the ACE scores of the children, comparing the cases and controls. So the children of women with substance use disorder compared to the women of controls. And you can see, we can go over, we're going to look at 3 and 4 or more at this time. So when you see this ACE score of 3, they're right there on that line where they are at grave risk for very high elevated risk for many negative health outcomes. Having a score of 3 does not mean that you have no risk, because you still do. It's just not at that alarming elevated rate of 4, but still, those 3s can easily become 4s. Unfortunately, one thing we did not do was take the ages of their children, which definitely should have happened and will be happening when we revise this study and go through it a little differently. But you can just see all of those children, 44, that was over half, because there was approximately about 86 children with our cases who had an ACE score of more than 4. So that's showing that these children are at risk for their own issues with substance abuse, many negative health outcomes. They're at risk for early death. We know that they're at risk, yet there's a lack of intervention at this point for them. And this chart here is just going to show you the relationship between a mother's ACE score and her children's ACE score. So for this analysis, we had to actually average out. So if a woman had maybe 4 children, we had to get the average for all 4 children and compare that average to her ACE score. But still, you can see that as a mom's ACE score increased, so does her children. So if mommy has a high ACE score, her kids are going to have a high ACE score. So we're just seeing that ACE is something that is inherited possibly through biology, but we also know for sure that it's being inherited with practice. So learning to parent from your parent, the stress of parenting, having a sensitive stress response, all those things are coming through and affecting the following generation. So here in this regression model, what we did was we were just looking to see what would predict polysubstance use. So we went through and looked at our women who had used 2 or more substances and tried to see what was helping to predict that relationship. So we looked at age, race, their education levels. However, ACE score was the only significant predictor. And you'll see this odds ratio here where it says 1.71, or well, close to 1. And what that is meaning is that for every ACE a mother has, her chances of being a polysubstance user increases by 71%. So, for example, if I have an ACE score of 1, I'm 71% more likely to use substances. If I have an ACE score of 2, I'm 142% more likely. And then we can go and think about when most of these women had an ACE score of 4, and they were actually 284% more likely to be polysubstance users. So just showing you there that there is a relationship between adverse childhood experiences and substance misuse. So just our kind of big points we can conclude from the study was that women who received treatment for substance use disorder and their children have high ACE scores when compared to controls. We know that when a mother's ACE score increases, so does the mean ACE score for all of her children. And we also see that as a woman's ACE score increases by 1 point, the odds of her becoming a polysubstance user increases by 71%. So considerations for the future. With this study, we kind of started to see some things. One, that substance use disorder is a problem that affects multiple generations at a time. And whenever a woman goes into treatment, it may be helpful if we also do interventions with her child. So when I say this, I mean, if a mother goes into treatment for substance use disorder, we have therapy, we have different things for the mother. However, the children are often, they're not included, and they're kind of waiting on mom to get home or waiting to see mom again. Yet these children are still dealing with the consequences of having high ACE scores. And so mom will come home, and that's something too that I always like to mention is mothers will come home and they've recovered, but they have children who are showing trauma symptoms, like I was mentioning before, school problems, behavioral problems, just an array, a whole spectrum of different problems that are stressful, and it can, in fact, be triggering for the mom and restart this process again. So when we're not treating the children, we're allowing them to grow up with this dysregulated stress response, and they are not able to cope properly. And we're going to see this cycle again. So therefore, in my opinion, it may be important to consider doing a dual treatment model for mothers and their children so that we can treat them together. Because this is a relationship where the substance use really impacts the child. When the child has a high ACE score, this can affect the mother, and it just goes back and forth. However, we are only focusing on mothers right now. And I do believe that is all I have. So we have a few minutes so we can do questions.
Anybody have any questions? I'm going through unmuting everybody.
Okay, I see that someone has asked, did you notice a major change the children were also served? In this study, we did not look at children who also served, because in our sample, women at recovery point, their children aren't involved in treatment. There may have been some small visitations, but there wasn't any type of formal treatment for the children. So that's why I said it's important for us to consider this, possibly do random control trials so that we can start practicing. Okay. So I see another question here that says, is the adult treatment model in practice for therapists to work with women and children now? As of right now, with the big ones I know, I do not see any of them doing intensive treatment for both the mother and the child. I know that it may be happening at some places. However, I'm not sure that they're actually bringing them together and treating them together. So with adult treatment, basically what I'm trying to say is we may want to consider that as our standard of care rather than an exception, because I know there may be some places who do some small interventions and do some things, but there aren't any, that's not what's happening anytime a mother enters treatment. It's normally hard for her to find this. Are there any follow-up studies in the works? So this, for me, I'm an undergraduate student, and I do plan on continuing my PhD. So in the future, I will be making a bigger study off of this data. So getting the ages of children and also getting more women's more qualitative work, so more quotes and different things like that, so that we can start seeing, are they even open to this? How would they like to see a dole treatment model working, et cetera, et cetera. So in the future, yes, I do plan on doing a lot of follow-up studies, but it was not in connection with the Clinton and West Virginia ACES study.